Yeah, now I manage it with weightlifting. I've been, I joined your y'all's gym, so I get a lot of load there, a lot of volume, and that's the best thing for my spine. It's the best I've ever felt is staying active in the gym and working out.
When they say with bulging, right?
Mm-hmm.
Was the default recommendation surgery back then?
Good question. Back then, I don't think we talked surgery. I think we got the MRI and then we talked injection. Got the injection, but I was nowhere to have surgery. I was a college student, didn't have insurance, just wasn't an option. Mentally, I was super scary, right? Someone cutting next to my spinal cord. Don't want to do that. So yeah, it was never an option on the table.
Mm-hmm. So moral of the story, lift weights.
Generally speaking, a lot of problems would be solved if people just moved more and lifted more weight. Yeah, 100%.
There's a few doctors now. Actually, there was one doctor that I forgot her name. I wish I knew her name, but I wish I remember. But she's telling women now to lift weights, and even guys tend to lift weight to begin with. But when you're in your 20s and your 30s, you have to build up that muscle because it's going to be your body armor when you're 60 and 70. I mean, yeah, there's like some studies that say that the stronger your grip, the longer you're going to live, but that's just a proxy for actual strength, right?
Yeah.
So build as much muscle as possible.
Yeah, there's correlation with grip strength with longevity and lifespan. Recently, they came out a study with quad strength, so knee extension strength correlating to lifespan and longevity. What do those two have in common? Strength, So generally strength. What is it? I think it's after the age of 30, each decade of life, we lose 10% of strength in general. So like 20 to 30 is that crucial range to boost testosterone, to boost muscle mass, to boost bone mineral density, to set yourself up for success later in life.
What do you think though of people who say that when they're already 40, that's it? That's
like it's too late.
Old. Yeah, it's too late.
Well, I would refer back to that stat, in 10 years, we're 10% weaker. How can we mitigate some of those risks in that strength training?
Yeah.
Functionally, it's always going to be helpful in later in life. How do we get up and down from a chair? We squat, How do we carry our groceries? We do carries, How do we get off the floor? We pull up from something or we stand up in a lunge. So it's super functional. But yeah, I would argue it's never too late. There's some good physios out there through ICE, Institute of Clinical Excellence, really pushing and advocating for older people to also work out. They're saying is old, not weak. Great education from those people. Dr. Dustin Jones, I believe it is a big leader in that space. So check him out. But yeah, it's never too late.
Never too late. Yeah, CrossFit, even with CrossFit, they have a course dedicated to coaching the aging athlete. Nice. And when I read the book, this was a long time ago though, so they were saying that even guys or everyone in their 40s and 50s, they're still hitting PRs, and it's wild how your body can still improve or at the very least mitigate some of those bad stuff that might happen down the road.
For sure. So, our bodies are great at adapting. I think it's really what it comes down to. We adapt to our environments. We adapt to the stressors and the loads that we put through our body and tissues. I think generally, when we think about lifespan, we go through phase of being more active as a kiddo. We got school with recess. We got sport participation, things like that. We get in our 20s and 30s, start getting in our career. We stop playing sports as much. We might stop working out as much because we have more time constraints. We might be working 40 hours a week or more. We're commuting. That's even more time of the day. So we have less chances potentially, but I don't think it's that we're aging. There are some physiological changes as we age and hormonal changes as we age, but it's less about aging. It's more about what are we doing? We're moving less. We're sitting more. We're going to sit in our car to drive to work, to sit for 8 hours, to sit in our car to drive home, to sit at dinner, then sit on the couch and watch Netflix. Like, what are we doing?
Yeah.
And then we just think we're old. It's like, oh, I'm just 50. I'm just getting old. I'm like, no, you haven't done shit in a long time.
With that being said, let's talk about some of the daily habits that people have that it's just ruining their movement ability. Mm-hmm. And then you mentioned sitting.
Sitting's huge. I'm sure you've heard sitting is the new smoking. That's gained some popularity, which I think for good reason. That example of sitting all day as we sit now, right? sitting all day, drive to work, sit for work, drive home, sit for dinner, etc. We are adapting to that. Our body's adapting to that. Our hip flexors get tight. Our pecs get tight. Hamstrings get tight, things like that. And then things get harder because we're not adapting to a strength stimulus. We're adapting to sitting more, and we're getting super comfortable in that.
Yeah. When I got my job, before I have my job right now, because it's a desk job, I was working with USA Swimming, and about 60-70% of it is shooting videos. And then you go back to the office, you edit, and then you go back and shoot. You travel, you go shoot. It's a lot of movement. And then when I got this job, I was like, that's when I started getting some back pain, and I thought it was just like bulging disc and stuff like that. And then I got an X-ray, and then they said my hips are tilted. I was like, oh, your one of your glute atrophied, and I was like, oh, it's my desk job, like just sitting like 8 hours a day. So now I got a standing desk, and now I'm like building up the strength thing in the back. So yeah.
And what did that do for you? Did that make a change?
It made a change. Yeah. I can. It used to be I couldn't even pick up 135.
Wow.
And now it's like, I during the open I cleaned I clean and jerk 275.
Wow.
So yeah, it's
Dude.
the strength, like kind of like what you said too, because in my case I was scared to use it. I was really scared, and it got worse and worse and worse. And then doing research and doing a talk to like a PT over at a physical personal trainer, though. He's a personal trainer, but he gave me some exercises and that helped me. I was like, okay, I'm in the right track. So,
yeah.
What else do you have, like some bad habits that people, that's like ruining people's movement ability?
I think this could be harder to conceptualize as a movement ability, but the nutrition. I didn't know how bad junk food made me feel until I stopped eating junk food. Now, if I eat one thing that's processed or junk or fast food or whatever, tears me up. But we're good at adapting, right? So if you eat junk food every day, you may not feel it, but it's tearing you up, and it's hurting your cells. At a cellular level, it's destroying everything inside our body. I feel, long term. So the nutrition part, sitting too much and eating like shit.
Yeah.
Those are the top two that come to mind. And that's generally low hanging fruit. Go for a walk, at least one a day. Like they've even brought down the step count down to 7,000 instead of 10. Super attainable goal, assuming you're able-bodied, right?
How many minutes is that? How many minutes is 7,000 steps?
Good question. Under an hour.
Under an hour.
Yeah, you can break it up.
That's not a lot.
No.
What else? You got any more?
Things that come to mind that are hurting people's movement ability.
How about
I think the lack of mobility, but that refers back to that sitting. Like we're just not moving our joints through full range of motion. So not doing any type of like mobility training. I'm not saying you have to stretch, but any kind of mobility or yoga, Pilates, things like that are great adjuncts.
You mentioned something about stretching earlier. Let's talk about stretching.
Okay.
For a workout, is it really going to prevent injury? Stretching?
No.
Explain. Yeah,
Short answer is no. There are different types of stretching, static versus dynamic. So static is like we're going to stretch our hamstring for a minute. You see that at every 5K. Somebody wants to lean over and touch their toes for a minute, and then they're off to the races. Studies time and time again show that static stretching before activity decreases performance and power output. So a dynamic stretch, something where, let's say, for example, instead of a hamstring, touch your toes, we're doing long leg kicks, soldier walks, whatever you want to call it. Something that's quick, you get a quick stretch to the nervous system, you get a little bit of blood flow down. That's much more helpful than static stretching. So in a general sense, you're going to do dynamic stretching prior to activity or workout. Static stretching can be nice for after to try to gain range of motion.
In what way does the static stretching degrade performance? Is it because the muscles get stretched too much that it won't go
harder time to contract?
Yeah, it won't contract as fast.
Won't contract as fast.
Yeah.
Yeah, that's the thought there. So we're like stretching out more sacromeres. We're not getting that tight, quick contraction.
In terms of injury, people still can get injured.
100%. Yeah, I think what prevents more injury is loading tissue. Okay. So we have our tissues have a capacity just like anything else: bones, ligaments, tendons, muscles, etc. Through strength training and exercising, our goal is to raise tissue capacity So injury rate is harder to get to. If we keep capacity low, we're going to exceed that likely through a high intensity workout, going for a quick jog when it's been a month since you've done it. That's where we get those injuries and those flare-ups, the tendinopathies and acute tendinitis and things like that.
So for a runner who gets injured all the time, let's say an ultra runner, or I've heard of some triathletes like getting injured all the time. Would it be valid to say that strength training would make them more durable then?
100%. Those folks, how do I say, are usually a little different breed, the ultra runners and the triathletes. But in general, yeah, the ones who are successful and the ones who are staying out of PT offices and orthopedic offices are strength training regularly, 2 to 3 times a week minimum. And it's not until they do that, they won't see their performance take off. They'll see the recovery take off. They'll hit PRs. But yeah, it all kind of comes back to that strength piece.
Yeah, you said like all roads lead to load.
Yeah, it's a nice quote from many faculty, but mostly Dr. Jeff Moore at ICE Physio, Institute of Clinical Excellence. All roads lead to load. So they do a lot of continuing education for physical therapists. I'm currently on their orthopedic certification track, and then I'm taking their fitness athlete certification track as well next year. But they preach on that. That's big for them. And they're, again, back to the whole tissue capacity. We're trying to raise tissue capacity so that injury rates and exceeding capacity is harder to do. Does that make sense? Like on a graph, raising tissue capacity, make it harder to reach your limit. But they're big on skilled manual therapy. You know, we're doing dry needling, we're manipulating, et cetera, whatever we need to do. Patient education to inform them on what this is, what it looks like, how you can recover from it, and then loading people. So no matter what it is, we're loading some kind of tissue.
So I'm guessing though, like if they're, let's say, injured in some way, like you, because that's the scary thing about like for me as a CrossFitter too, right? You know, when someone's injured here and like, I don't want to, it's not like I'm bragging, but like I've had athletes who think like I'm a doctor or something. Like they'll ask questions about stuff that they should be asking their doctor. So it's like kind of scary for me to ask to answer those questions, or you know, if there'd be nagging shoulder, I was like, I'm not really comfortable telling them to do an exercise that I saw online on YouTube. So I was like, all right, I'll just say go to a PT or just like you. Like, what do you tell someone like that? Like, you know, so when customers, let's say clients, go to them and say, hey, my shoulder's hurting, what should I do?
So are you asking for my approach, like if we're in the gym setting and they ask a quick question, or if I'm like evaluating in the clinic?
Like a gym setting.
So gym setting can be tough, right? So I'm trying to give them some quick advice just to calm things down. My general advice is we can almost always find a modification. So if it's a shoulder thing and we're doing a lot of snatches that day, can we modify that to a dumbbell instead of a barbell? Can we lighten the load? Worst case scenario, we're going to do something different, something accessory, but we still want to pump blood around that area. So if a snatch is super uncomfortable, maybe we're going to just swap them out for a bent over row that day. Maybe we're going to do a 1-arm press, you know, keep it close to bicep to the ear kind of thing instead of more abducted out here. Finding something that's a little bit more comfortable and let them run with that is largely beneficial because we're getting that systemic blood flow pumped to the area and to the rest of the body. So I think we miss out on a lot of opportunities if we just tell them to rest it or like skip the day. I think that's some of the worst advice we could give them. We still want to keep them in the gym. We can always modify. And you guys are great as coaches of modifying stuff. You know, let's find something that you can do. We're going to hit that hard today. Yeah. Worst case, we're getting on the bike, right? Something. Blood flow.
Yeah, that's usually a scale. We say it's one of the go-to words that CrossFitters use. Scale, you know, because you can always scale up, you can always scale down. It's what we're trained to do as well at CrossFit level 1 and 2. That being said, though, now that you're a CrossFitter, share your experience. You know, how did you get to this point? How did you become a CrossFitter? What were your do you have any second thoughts about doing it? What were the things that you've heard about it? And let's go.
Yeah, so I was always told it's kind of the cult, you know, you're just gonna tear up your body, it's so bad for you. It's going to jack up your shoulders. You're going to hurt your back. It's too much volume, et cetera, et cetera. Even back to PT school, I had colleagues who kind of put it down or thought it wasn't beneficial. within a month of getting in here, I love it. I mean, I think it's the intensity that I was missing. I lifted weights in my garage gym, but I'm not pushing myself the way coach pushes me. I don't have that supervision. You guys are so good about going through the fundamentals, movement preps, walking around the room, making sure everyone's dialed in on technique. I think CrossFit gyms that may be overlooking that, yeah, probably going to have some more injury rates and higher risks and things like that. But from my experience at Endemic and working with you guys, it's been wonderful. But yeah, I love the intensity. I'm going to sign up for a competition in April. The True Challenge, I believe.
I don't know. I've heard of it.
It was like an entry level, scaled CrossFit event. I'm going to check it out, but
it's probably the Festivus. I think they rebranded Festivus.
Yeah, it's that one. I'm
That's my favorite competition.
Oh, really?
Yeah, I did. My first year, my first 2 or 3 years, I kept doing it. Yeah,
nice.
Yeah.
So I'm going to hit that in April. But yeah, it's been great. I think the overall intensity is a really nice piece that a lot of people are missing. The full body movements, like we're not doing leg day or like arm day, right? We're hitting almost full body movements every single time to different degrees and different volumes. But it's been great for that. I think the community environment is underrated, and I think that's a huge piece. Like to get in here with other people working hard and pushing each other and just being motivated is huge, and it's so good for people, you know. Our socialization has come down, our physical activity has come down over the year, especially with COVID. So to be in an environment where it's a group setting, I think is huge for people, and I really enjoyed it. So,
do you have CrossFit clients?
Mm-hmm.
What's the most common injuries that you see that they have?
Yeah, I see quite a few CrossFitters now, and I've been working with Pinnacle Weightlifting for a couple of years. So I see those Olympic weightlifters. Both of them, most common is definitely shoulder. Definitely shoulder. I would probably go hip or back for number 2. Maybe hip then back, surprisingly, a little more hip stuff. But what I find out, and this is why I think it's huge to see a professional, is most people have some deficit that they're training through, and it's just a matter of time. It's a matter of volume and a matter of time that until they're going to feel it. And if they don't address it, we're likely just getting worse and using some compensatory strategy. An example I can think of, I got a 48-year-old lifter. He's been a CrossFitter his whole life, owned a gym here in the Springs. Now he's a competitive weightlifter last couple years, Masters division. Started having some shoulder and neck pain with overhead days, a lot more snatches and stuff like that. Come to find out, significant lower trap weakness on one side, some instability overhead. So his glenohumeral joint is less stable overhead from less efficiency in the rotator cuff and other stabilizers. So dialing that in, just giving him a few drills to do, priming himself before overhead days, neck pain's already resolved. Now we're dialing in the shoulder. So I think a lot of times people just have these underlying impairments that maybe are missed or not addressed through their own gym or whatever the case may be. I think it's important that you guys do the fundamental one-on-ones so you can kind of dial some of that in, because in a group setting, it can be hard as a coach to see 15 people and point out those subtle differences. But yeah, with those overhead lifts, the CrossFitters and the weightlifters, more shoulder stuff.
What do you think causes, let's say for a snatch or a jerk, is the internal rotation? Is it more of an internal rotation problem or external rotation that causes?
Of the shoulder?
Of the shoulder. Or does it depend to, because I've heard all kinds of arguments for it.
Yeah, man, there's a lot of stuff online for sure. You could YouTube anything and get some misinformation. That's why I always say see a professional in person. One thought is you can come to my shoulder workshop February 20th, 5:15 here at Endemic. And we'll really hone in on stability versus mobility. We need a little bit of both. But as far as internal or external, if I had to choose one, you're talking about snatch specifically? More external.
External.
Yeah. And that could go 2 different ways. Are they limited in external rotation where they can't get all the way in that position? Or do they have weakness in external rotation that doesn't provide that stability up top whenever they're in that position?